Before we begin, let's just say that privatisation in many areas doesn't seem to be working out for the average taxpayer. Water companies, for example, are providing a service and pumping into rivers and the sea. So it's interesting that Sajid Javid, writing in the Times, has just said this.
We should look on a cross-party basis at extending the contributory principle. This conversation will not be easy, but it can help the NHS ration its finite supply more effectively. Too often the appreciation for the NHS has become a religious fervour and a barrier to reform. We need to shake off the constraints of political discourse and start having a grown-up, hard-headed conversation about alternatives.
It's also interesting that General Secretary for Unite, Sharon Graham, was on Radio 4's Today programme, Today, saying this about government negotiation for pay for ambulance workers.
In a normal working week, 500 people are dying in a normal week waiting for an ambulance. The NHS is literally on its knees, and patients are dying every single day unnecessarily because of the crisis in the NHS.
How does this improve that?
Well, what we're trying to do is that we're trying to get the government to negotiate. It's been 5 weeks since Unite ambulance workers were out, and in that time there has been literally no meeting about the substantive issue of pay. So this is out of frustration. I would have thought that over 5 weeks that Stephen Barclay and Rishi Sunak could have decided to come to the table and talk about pay. I'm concerned, I have to tell you, that they do not want resolution to this dispute. I have never had a situation where the CEO of a company, which is what Rishi Sunak is not coming to the table himself and trying to deal with this. He is missing in action and he needs to get back involved.
Don't want a resolution to it for what reason? What could possibly be in it for him?
Well, you'd have to think, and I am seriously now thinking, that there's something more sinister than this. This is an act of self-harm. The public are behind the NHS workers getting a pay rise. We have the money for NHS workers getting a pay rise. We're the 5th richest economy in the entire world. Why are they not coming to the table? I believe that they have an agenda in terms of privatising the NHS. Sajid Javid's comments over the weekend weren't done whoopsie-daisy. They were very deliberate. They were a flag to see how it flew. I am very, very concerned now that they have another agenda. And I've never been in a situation in 30 years where the people that we're trying to get resolution with do not want resolution.
You only have to Google Tories and NHS Trust to find multiple links between Conservative ministers and private healthcare providers. I wonder if the Tories are doing such a shit job with the NHS, and so getting rid of staff, they'll be able to push for a service that we'll all be charged for. I wonder. See how Rishi saying that the NHS is getting record funding is a load of crap.